Vertigo is a condition of reeling sensation where people may have feelings of their surroundings as spinning or moving. It may be associated with nausea and vomiting. Many medications are used to treat symptoms of vertigo. Interestingly, both histamine antagonists and histamine analogues are used in the treatment of vertigo. In this video, let's cover all such medications, discussing how they act, what are the important side effects are. First, let us see what causes vertigo. Vertigo is mainly produced by a few problems in the inner ear. The inner part of the ear is involved in the balance of the body, and it estimates the position of the head where it is. If any problem in the inner ear may develop few symptoms like nausea, vomiting and spinning. This condition is collectively called vertigo. One of the common causes for vertigo is the benign paroxysmal positional vertigo, commonly called as BPPV. In this condition, people may have short episodes of vertigo with feeling of spinning or movement of surroundings, particularly when they change their head position. That's why it is called positional vertigo. Here the term benign indicates that it is not that much harmful. Paroxysmal means a sudden increase in the symptoms and repeated attacks. So in this condition, people may have vertigo without any previous warning symptoms. They may have a sudden attacks of vertigo when they change their head position. In a few people, this may produce unsteadiness and involuntary movements of the eye. This condition is called nystagmus that may be associated with vertigo when they change their head position. One of the main reasons for the BPPV is the fluctuations in the inner ear. A few tiny calcium crystals in the inner ear may be dislodged and they can move from one part to other part of the inner ear, which produces an imbalance. This imbalance may result in the symptoms like spinning, nausea and vomiting. BPPV is commonly observed in the elderly. It may result in short, intense episodes of vertigo with change in their head movements. So when you are rolling over from one side to another side on the bed, you may feel a spinning sensation. Another reason for the development of vertigo is any infection or inflammation in the inner ear. One of the conditions is the vestibular neuritis. It is an inflammation of the neurons supplying to the vestibular system, which plays an important role in maintaining the balance of the body. These neurons are connected in the inner ear to the brain. Inflammation of these neurons can produce some imbalance in the body, resulting in the nausea, vomiting, spinning sensation and jumping vision. Normally, this inflammation can be produced by any infections like viral infections. In such conditions, the viral infection can be properly treated to relieve the symptoms of vertigo. Another condition is the labyrinthitis. It is an inner ear infection that causes inflammation of the labyrinth. The labyrinth is mainly responsible for control of balance as well as hearing. Any inflammation to this labyrinth called labyrinthitis. It may result in the development of symptoms of vertigo. It can also produce some tinnitus, ringing noise in the ears, along with spinning sensation, dizziness and loss of balance. It may also involve hearing loss in the people. Either bacterial or viral infections or even allergic conditions may increase the risk of labyrinthitis. Chronic smoking and stressful conditions can also increase inflammation. Intake of large amounts of alcohol may also lead to ear infection and labyrinthitis. Another cause for vertigo includes Meniere's disease. It is not common in all and rarely observed in a few people. This condition is caused by buildup of fluids in the labyrinth, which produces some imbalance and difference in the pressure, leading to the development of symptoms like vertigo. However, this also involves other symptoms like tinnitus, ringing noise in the ears and hearing loss. Some pressure in the affected ear, sweating, headaches, nausea and vomiting can also be observed. The vertigo attacks can be observed after a short period of ringing noise in the ears. They may have drooping of the face to one side, difficulty speaking, vision problems in one eye are also observed. A low salt diet and use of diuretics may improve the excretion of these accumulated fluids in the ears, which may relieve the symptoms of Meniere's disease. People with recent strokes, untreated migraine attacks, head injuries may also develop the symptoms of vertigo. Now let's see what type of medications are used for the treatment of vertigo. The treatment depends on the severity of the condition and what is the root cause of vertigo. First one is the antihistamines. One of the popular medications for treating vertigo is antihistamines. Medications like Cinnarizine, Cyclizine, and Meclizine can be used for this purpose. One of the purpose of antihistamines is to reduce the nausea and vomiting. They can act like anti-emetic agents. These antihistamines block the signals to the brain that develop the symptoms of vertigo, nausea, and vomiting. Among these drugs, Cinnarizine blocks voltage-gated calcium channels in the inner ear. This reduces the activation of vestibular system, thereby improves the balance in the body. The nausea and vomiting can be stimulated by the vomiting center as well as vestibular nuclei. On the vomiting center, histamine H1 receptors are located, which are responsible for the nausea and vomiting when they are activated. Antihistamines block these H1 receptors, thereby they can reduce the signals to the vomiting center as well as to the higher centers of the brain. This reduces the symptoms of spinning sensation, nausea, and vomiting. The common side effects of many of the antihistamines is the drowsiness. They can also produce other side effects like constipation, headaches, tiredness, indigestion, and difficulty sleeping. Cinnarizine can also be combined with another medication, dimenhydrinate, which is another antihistamine that can reduce nausea and vomiting. So in people with severe symptoms of vertigo, this combination can be given. Second category is the histamine analogues. Another popular medication is the Betahistine, which is a histamine analog. It locally increases the action of histamine in the inner ear. Histamine can increase the blood flow to the inner ear and brain, and by improvement of blood flow, the balance of the body can be properly maintained. It can relieve the symptoms of vertigo and tinnitus in people with Meniere's disease. Betahistine acts as a H1 receptor agonist, thereby it improves the blood flow to the inner ear. It also acts on H3 receptors, which are autoinhibitory in nature. These receptors are normally inhibit the release of histamine. Betahistine blocks these H3 receptors, leading to increase in the histamine transmission in the inner ear. It improves the blood flow, thereby relieves the symptoms of vertigo. However, this medication should be carefully given to the people with bronchial asthma. Since histamine can increase the bronchoconstriction in people with severe bronchial asthma, betahistine should be carefully used. Similarly, in the people with history of peptic ulcers, this betahistine can increase the gastric acid secretion by stimulating histamine receptors. So in such people, betahistine should be carefully used. In people with pheochromocytoma, an adrenal tumor, use of betahistine is contraindicated. Next one is the phenothiazines. Another medication is the prochlorperazine. This is chemically belongs to the class of phenothiazines and it is used to treat psychosis. Therefore, it is classified as antipsychotic or neuroleptic agent. However, this prochlorperazine can suppress the vestibular apparatus in the inner ear. Therefore, it can prevent the symptoms of vertigo. On the vestibular nuclei, dopamine D2 receptors are located. When they are activated, they can produce some imbalance in the body. Prochlorperazine can block these dopamine D2 receptors, thereby it can inhibit the activity of vestibular system. This can also suppress the nausea and vomiting. That's why prochlorperazine can also be used as anti-emetic agent. Since prochlorperazine is a neuroleptic, it can produce few side effects like muscle twitching, particularly at shoulders, face and neck. It can also produce some sedation and drowsiness in the people. Promethazine is another phenothiazine which is classified as antihistamine. It shares the properties of both antipsychotics and antihistamines. In people with severe nausea and vomiting, promethazine can be given. It significantly reduces the emesis along with reducing the symptoms of spinning sensation. Next one is the benzodiazepines. Benzodiazepines can also be given to control the symptoms of vertigo by reducing the vestibular system. Since these drugs are acting like CNS depressants, they can inhibit the vestibular activation that helps in relieving the symptoms of vertigo. Drugs like diazepam and lorazepam are commonly used. However, these medications can produce sedation, drowsiness, and muscle incoordination. In the elders, it may also produce some loss of memory. Next one, diuretics. Diuretics are given to remove excess fluid that is built up in the inner ear. So when the vertigo is produced by excessive fluids in the inner ear, like in the Meniere's disease, diuretics may be given. Drugs like furosemide, istazolamide, triamterene and hydrochlorothiazide can be given to remove the excess fluids in the inner ear. However, these medications can produce some dehydration because loss of body fluids. They can also increase frequent urination. Anti-inflammatory agents. If the vertigo is produced by inflammation in the inner ear, anti-inflammatory agents can be given. Corticosteroids can reduce the inflammation. Therefore, few medications like dexamethasone and prednisone can be given to the people with Meniere's disease. However, these medications should be given for a short-term period to avoid corticosteroid-related side effects. Ginkgo biloba extracts. Few of the herbal supplements can also reduce the symptoms of vertigo and even prevent the recurring attacks. Ginkgo biloba extracts are highly helpful in the treatment of vertigo by improving the blood flow to the brain as well as reducing the viscosity of the blood. Because they produce a thinning of the blood, they can improve the blood flow and reduce any clots in the blood flow. However, Ginkgo biloba may cause few side effects like headache, dizziness, abdominal pain and few allergic skin reactions. Other supplements. Vitamin D and calcium supplements can also be given for vertigo treatment. They can reduce the recurrence of vertigo attacks as well as they improve the symptoms of spinning sensation. So these are the various medications for the treatment of vertigo. Among these medications, antihistamines are the first line of agents which are used to relieve the symptoms of vertigo along with reducing nausea and vomiting. However, betahistine is a histamine analog that can also be used to treat the vertigo where it improves the blood flow to the inner ear. Benzodiazepines can also be given to suppress the vestibular system, and in the people with accumulation of fluids in the inner ear, diuretics may be given. If the inflammation persists, corticosteroids can be used to control the inflammation in the inner ear. So that's all about the different medications that are used for the treatment of vertigo. I hope this video is useful to you. If you really like this video, please subscribe to our channel and share this video with your friends. Post your comments in the comment box and don't forget to hit the like button to support our work. Thanks for watching. See you in the next video.